My name is Dr SOWMYA D RAO from Mangaluru Specialty Clinic. Today is World Diabetes Day. So, on this occasion, we would like to create some awareness about diabetes, pre-diabetes, lifestyle modifications, which is very much necessary in today's times. So, coming to pre-diabetes, the importance of early detection and management. So, what is pre-diabetes? Pre-diabetes is a state characterized by impaired fasting glucose or impaired glucose tolerance test. The pathophysiological defects underlying pre-diabetes include insulin resistance, alpha and beta cell dysfunction, increased lipolysis, inflammation, and suboptimal incretin effect. Recent studies have revealed that the long-term complications of diabetes manifest in some people with pre-diabetes. These complications include microvascular and macrovascular complications. The development of type 2 diabetes is an interlude of pre-diabetes, itself a toxic state that is associated with the development of macrovascular complications. Now, the pathophysiological defects in pre-diabetes. The known pathophysiological defects that underlie type 2 diabetes are being increasingly recognized in the pre-diabetic state. The natural progression of dysglycemia involves increasing insulin resistance and loss of pancreatic beta cell function. Significant defects in insulin action and secretion are consistently demonstrable in the pre-diabetic state of impaired fasting glucose. Now, what are the macrovascular complications of pre-diabetes? The macrovascular disorders associated with pre-diabetes include CVD, stroke, and peripheral vascular disease, that is cardiovascular complications, most commonly what you know as the heart attack. It could be stroke or paralysis, and the peripheral vascular disease, that is obstruction of blood flow to the arterial supply to one of the limbs. In fact, the traditional cardiovascular risk factors, that is dyslipidemia, obesity, hypertension, are quite prevalent among individuals with pre-diabetes. So, you may not present with obvious increased levels of sugars, but since you have all these risk factors and your sugars are in the impaired level, it is not within the normal fasting glucose levels or within the postprandial glucose levels, that is the state what is called as the pre-diabetic state. It is reported that most patients with pre-diabetes harbor features of insulin resistance, that is metabolic syndrome, including upper body obesity, hypertriglyceridemia, decreased HDL levels, and hypertension, which are the most common other associated factors. Components of the metabolic syndrome often can be identified in pre-diabetic subjects several years before the diagnosis of obvious type 2 diabetes mellitus. These features translate into advanced atherosclerotic vascular changes, which are often preceded by impairment of endothelium dependent vasodilatation, vascular smooth muscle dysfunction, and increased arterial stiffness. Pre-diabetes is associated with an increased risk of cardiovascular disease and death in both the general population and in patients with a history of heart problems. This has led to an increasing interest in earlier intervention in the time course of dysglycemia, focusing on the period before type 2 diabetes is diagnosed. So, what are the early interventions in high risk pre-diabetes? People at risk of diabetes, particularly those who are overweight or obese, or women with a history of gestational diabetes, that is diabetes during pregnancy, should be tested for the presence of pre-diabetes or diabetes alongside other cardiovascular risk factors, which, like already discussed, increased levels of triglycerides, obesity, hypertension, low HDL levels. So, lifestyle intervention remains the cornerstone of care for individuals with pre-diabetes and even diabetes. Based on an improved diet, regulate moderate physical exercise with the aim of achieving weight loss in overweight and obese patients. Currently, metformin is the only medicine recommended for the prevention or delaying type 2 diabetes mellitus or who are at risk for developing diabetes. These are demonstrated through various trials, well designed trials, and it is generally well tolerated with very minimal GI side effects. And the cost factor also is very important since metformin is available at a lesser cost. Currently, metformin has a therapeutic indication for prevention or delay of new diagnosis of type 2 diabetes in at-risk subjects in 66 countries. Influential guidelines for the management of dysglycemia or cardiovascular risk now acknowledge a role for metformin for diabetes prevention in defined subgroups of people at risk of developing diabetes due to presence of pre-diabetes or non-diabetic hyperglycemia. Metformin is now approved for use in pre-diabetes in India. Now, what are the lifestyle modification pre-diabetes? See, your sugar levels may not have increased, your HbA1c might be within the diabetic range, but still you are prone for diabetes because your fasting glucose levels is between 110 and 126, and you might have an impaired glucose tolerance test. That means in future you are at more risk of developing diabetes. So what can you do before therapy starts? What are the steps you can take by yourself to prevent this over diabetes to occur? So these are simple lifestyle modifications which everybody can start inculcating in their routine lifestyle. That is having food which is more healthy, green leafy vegetables, eating only required amount of carbohydrates, having enough amount of proteins, being physically active to lose extra weight. Like I said, having a healthy balanced diet, along with this practicing yoga, practicing meditation so that your stress levels decrease, which also will definitely be the cause for having diabetes. So make healthier choices and cut down the junk. Now coming to the use of metformin in India, the use of metformin among pre-diabetes in India is again reported to be much lower. There should not be any apprehension for starting metformin in patients whom the doctor thinks can develop diabetes, so that you can prevent diabetes in the patient. The common concerns raised regarding the medicalization of pre-diabetes are increased health expenditure per person, and the use of metformin in pre-diabetes would lead to lesser emphasis on lifestyle intervention. This may have some relevance in the Western world, where dynamics of pre-diabetes are more benign, lower disease burden, low annual rate of progression to type 2 diabetes. Cost of healthcare is in general is believed to be very high. However, these challenges are far greater in countries with limited population awareness like in India. Therapeutic lifestyle intervention remains a first step, and the involvement of nurses, paramedics, social workers, teachers and school children is critical to the mobilization of citizens and the generation of subsequent political will. Policy of the state, it is necessary for success of such programs. So it is not a one-man show, it is a combined efforts of all sectors of the society so that we can decrease the disease burden. Metformin is a generic drug, cheap, widely available both in the government sector as well as in the private sector. Hence, additional use of metformin may be encouraged in the subset of pre-diabetes with multiple high risk factors which are associated with the highest risk of progression to type 2 diabetes. These risk factors include the presence of a strong family history of type 2 diabetes, obesity, especially central obesity, history of gestational diabetes, that is diabetes during pregnancy, occurrence of both impaired fasting glucose and impaired glucose tolerance test. So to conclude, In contrast to concerns raised regarding the medicalization of pre-diabetes, it is perhaps high time that pre-diabetes is treated with due seriousness. Let us not take this variation in the sugar values very lightly, because in today's times it is very likely to progress to type 2 diabetes. Lifestyle intervention is the first. See, whatever medications the doctor starts, but from your part, lifestyle intervention still is the priority, is still the first step which every individual, irrespective of whether pre-diabetic or not, whether diabetic or not, has to take, so that if he is not a diabetic, on the verge of developing diabetes, he can postpone it, or if he is a diabetic, he can prevent the complications of diabetes. So, lifestyle modification has to be done aggressively. Awareness should be spread regarding the use of metformin in pre-diabetes patients, and also awareness about the disease itself, the complications of the disease, what are the modifications an individual can take, has to be spread across, so that in the future times, the disease burden of diabetes and the complication of diabetes can be prevented. Okay, this is about pre-diabetes, but today is also Children's Day and today is also Deepavali. So I would like to wish everybody, all the children, happy Children's Day, and everybody a happy Deepavali, and also stressing upon, as it is World Diabetes Day, take care of your health, stay happy, stay healthy. Thank you.